Good morning, everyone. Welcome to our Summer Prevention Webinar Series. We are hoping that you can hear me now. If you cannot hear me, please, well, I guess you wouldn't know that I'm talking then, would you? But if you can hear me, if you want to go ahead and just type in our question box that we have and let me know that you can hear me. Even just a handful of you would be great, just so that we know for sure that, all right, it looks like a few people can hear us. Perfect. Awesome. Thanks, everyone. So good morning. My name is Jessie Corcoran. I'm the Prevention Coordinator here at WCASA, and this is our Summer Prevention Webinar Series. Kelly and I wanted to organize this opportunity, this prevention learning opportunity in the summertime because we know that so many of you are in the schools, and the school year can be a very busy time for a lot of prevention educators. So we're hoping that this series so far has been helpful to you. If you do have any feedback or ideas for future webinars, please do email me at jessiec@wcasa.org. I would love to hear from you, have any feedback that you have for us. But really quickly, I just want to give you a quick overview. So these top two webinars are the ones that we've already done. I won't spend too much time talking about them, but do know that we have recorded them and they are archived on the website. I'm not sure if they're up on the website yet, but if they're not, they will be very shortly. Another note, our webinar that we had scheduled last week has been rescheduled. So that will actually be Tuesday, August 9th, 10 a.m. to 11:30 a.m. And we're going to send out more information regarding registering for that today. But today's webinar, I'm very, very excited to announce, is from Amy Olejniczak and Erica Koepsel from the Wisconsin Alliance for Women's Health. They're going to be talking about involving teens in prevention work. They do some really amazing stuff with their PATCH program, and we are extremely excited to have them here. Just so you know, if you have any questions, please do use the questions box on your panel, on your control panel from GoToWebinar. Type in questions there. Kelly, when we start getting questions, she's going to read them out loud for everyone, and then hopefully we can have our presenters answer that question. And also, if our presenters ask any questions, you can use that same question box to provide answers as well, and we'll read some of those answers out loud for those of you who provide them. So without further ado, I'm going to turn it over to Amy and Erica.
All right, thank you so much, Jessie, and thank you for, you pronounced my name. I didn't even have to tell you how to pronounce my name. That was really, that was a first and very exciting for me. So welcome, everyone. We're so happy to be here today. I am Amy Olejniczak. I'm the director of the PATCH program, and I'm here with Erica Koepsel, who is our PATCH manager and site coordinator for our Dane County team of teen educators with the PATCH program. The PATCH program stands for Providers and Teens Communicating for Health, and is a program of the Wisconsin Alliance for Women's Health. Really our mission of our organization is to raise the status of Wisconsin women's health by engaging, educating, empowering, and mobilizing individuals and organizations. I imagine that we've worked with a lot of you on the phone in various capacities doing various prevention work throughout the state. We are a statewide organization, and if we haven't worked together in the past, we should in the future. So please, let's connect. We are also, I'm going to take a quick pause while our slides are moving ahead without us, I think. So we're just going to take a quick minute to get those slides under control before they give away our entire presentation.
Sorry. Also, hello. I was worried about the slides. This is Erica. I'll be talking with you in a minute. I'm going to let Amy kind of take over the beginning.
And I'll just go ahead and maybe while we get that figured out, just do we'd like to start just by talking a little bit about the PATCH program, and maybe this is a good time to ask a quick question and just get a feel for, has anybody been in a PATCH workshop before? Have you sat in a room with our teen educators and been part of a PATCH workshop or experience? If you want to just type your answer so we kind of have a feel for where everybody's coming from, that would be great. We'll give you just a minute to do that. Thanks, everyone, and thanks for your patience. I think we almost have our slides back in our own control, so just one more minute here.
We have a few responses, people saying, no, they're new to PATCH.
Thank you, Kelly. All right. Great. Well, we'll start from the beginning and hopefully, hopefully give you a good enough introduction that the rest of the webinar feels relevant and important for you. So I'll just go ahead, I think, while we're working on the slides here and give a little overview of the PATCH program. So we really founded the program recognizing that that in terms of adolescent health, teens are really at risk for a lot of unique preventive health issues that we can work with them very closely in a really unique way. So adolescent, we know that adolescent morbidity and mortality are really related to behavioral choices and have the opportunity prevention. So we really, we recognize that teens themselves are the population most at risk for failed patient-provider relationships. We also recognize that teens who have a negative experience with a healthcare system or a healthcare provider are a lot less likely to return for follow-up or future care. And this is the same within, a doctor's office, within a clinic, within a social work setting, even within a school. Really working with adults that don't meet their needs are going to make teens a lot less likely to return for follow-up care. And I think that's true of all of us. We're all, we recognize when something goes badly, even as a consumer, we're not going to go back and buy the same thing twice from a failed relationship. We also know that teens are the group most likely to underutilize preventive health care. And so really recognizing that this is an area where we can really empower them to become engaged, that they do have the capacity to stay engaged in preventive health care and to really recognize that lasting effect of health on their future. So the PATCH program was really founded with the intention to target barriers that interfere with the ability of healthcare professionals of all types and teens to communicate effectively with one another, specifically about sensitive health topics. So we talk a lot about those health topics that are stigmatized: sexual health, mental health, safety in the home. A lot of those topics that are hard to talk about for young people, and also hard to talk about for adults as well. And we really, we work to kind of put teens in the driver's seat of this program. So all of our workshops are led by trained teen educators. The teens themselves are hired and trained throughout our program, which we're going to talk about in detail in this webinar, and become sort of the conduits for this communication between themselves and healthcare providers. So we really are putting them out on the front lines as educators, and they do an amazing job. And I think they do so really because of the fact that they're empowered to find their voice and to recognize that that the part that they have to play in preventive healthcare is incredibly important. I'm going to spend just a quick minute talking about the program history. And we'll encourage you, so after this webinar, there'll be I think a link to the video will be emailed out. We were going to show a quick video there about to give you some more insight into the PATCH program. We'll send that out after the webinar, and I encourage you to watch that and hear directly from some of our teen educators that are featured in the video about what they do and how they do it. But I'll just give a quick history of the program. Some of you may be familiar or may have interacted with us when we were the Wisconsin Adolescent Healthcare Communication Program. So in 2010, we were founded with that name, which is a terrible name. The teen educators called it WCASA, which sounded more like a cough than anything else. But we recognized throughout the last 6 years that name really had to change. But that's who we were in the beginning, and we were really founded from. We had a $10,000 grant in 2010 that was from the National Institute for Reproductive Health. And the program was really founded as a way to get teens and healthcare professionals talking openly and honestly about sexual health and reproductive health. We brought a version of that program here to Wisconsin and really adapted it for our state, kind of that natural adaptation, recognizing that teens here are different than the teens in New York, that we're doing a very similar program out there, and that we have unique needs here in Wisconsin, and really kind of adapted the program to suit our teen educators here and their unique needs. Very soon after that, we recognized that that sexual and reproductive health is not the only thing that teens have a hard time talking about with trusted adults. Imagine that. But we really recognize that there's a lot more going on. Mental health was a big one for our teen educators. LGBTQ health came to the forefront as something that we really need the language to talk about more openly and honestly, both teens and healthcare professionals. So we really kind of expanded the area of health topics that we're talking about in our program and in our workshop delivery to be really inclusive of all sensitive health topics or all things that teens might have a hard time talking about with a trusted adult. So anything from drug and alcohol use, safety in the home, the health of their relationships are all really important things that we talk about. And again, really, our job really is to focus on building trusted relationships between teens and adults, adult caregivers, specifically those providing preventive care, and really recognizing that open and honest communication and a solid relationship is going to be key to getting an accurate health history from a teen, and really recognizing what's going on in their life. And then, as I mentioned before, we rebranded. We became the Patch program, which has been just easier to say in webinars for sure, and a lot easier for folks to, I think, recognize us in the community. And then finally, just to touch on some geographic expansion. So we are, again, in 2010, we started the program in Dane County, and we have been here in Dane County ever since. And we have done we did a pilot site in Wood County, Wisconsin, with a grant in 2011, and are now actually launching a full site in Milwaukee. And so we currently have a team of teen educators here in Dane County and in Milwaukee who start training tonight. Actually, here in Dane County is their first night of training, and also look forward to further expansion as we grow and move forward. And actually our next slide, I think, just gives a quick sample of our reach and where we've connected with healthcare professionals and where our teen educators have done presentations. So again, we look forward to connecting with you wherever you are in the state and looking for opportunities moving forward. All right, so just a quick overview kind of what happens in the Patch program throughout the year. As I mentioned, we hire and train teen educators that are really the key and the core component of our program, and that's what we're going to talk the most about today. Those teens are hired through an interview process and trained. Again, they start tonight, and then have ongoing enrichment for the school year. So we start here in August and we end our program year at the end of May. So we really coincide with the school year. During the year, the teens do workshops for healthcare professionals and really are the educators in that room. So they get up in front of a group of doctors and nurses and other health professionals and become the educators, and the adults in the room become the learners. And it's a really beautiful way to see teens being empowered, to really see them recognize that there are folks listening to them and hearing what they have to say and taking what they have to say into consideration. We also have a Patch for Teens curriculum, which we're actually piloting a new version of that this fall in classrooms. So that's a curriculum delivered by health teachers, school nurses, other folks that are interested in delivering a Patch for Teens curriculum in schools. If you're in that realm and interested in that, or know somebody that might be interested in piloting that that new version of Patch for Teens, which again we've been doing outreach for teens for many years. It's sort of a new delivery model we're interested in piloting. Please feel free to contact us after the webinar and let us know. And then we're also at Patch developing Patch for Parents. So we're looking to really develop some powerful resources that can coincide the youth empowerment activities that we do, and really bring parents and guardians into the conversation in a very healthy way. As always, process and outcome evaluation and ongoing improvements, dissemination of the program are all very integral pieces of what our program year looks like. So today we're going to focus on those top two pieces of the bigger picture, the hiring and training of our teen educators and the enrichment that they go throughout the program year. Our goal really, I think, is to impart on you some of what we have learned over the past 6 years, empowering youth to become engaged in preventive health care, and really looking at what has worked for us and what we've learned from what hasn't worked so well. So we'll go ahead and jump in with kind of what works with our Teen Educator Model. We really look at our Teen Educator Model as kind of an employment model, and this has worked very well for us in that we have the unique ability, kind of as a standalone nonprofit, we have the ability to hire and pay the teen educators to be engaged in the preventive work that they do. It's not, so we pay them $10 an hour for their workshops, which is a lot. You know, they're thrilled to get to hear that $10 an hour phrase. And for us, it's doable as a nonprofit because they're not with us that often. So even though, you know, it's a lot based on the time that they're with us, we have the ability to pay. We usually pay each teen educator about $40 a month for the time that they are involved in enrichment activities, and then again, $10 an hour for the workshops that they do throughout the year. Being able to do that really allows us to kind of to treat their involvement in Patch like a job, which has the benefit of a number of things. One of them really just recognizing that that they have the ability to get recognized for their work, and that their time means something to us, and that we really respect that. And it also, again, allows them to participate in a way that maybe they haven't been looked at as a professional before, or they haven't participated in something as a professional before. So giving them that opportunity has been very important to us. We also have the ability to interview them and to really screen for teen educators that are going to be successful. And we've learned a lot in that interview process. So one thing that we really look for when interviewing is just a teen that has a spark, that kind of has something there that allows them to understand and be passionate about prevention in some way. So we are not looking for good grades. We are not looking for past work experience or any of the other kind of traditional successes that traditionally would get somebody a job. What we're really looking for is a teen who has a story or an experience or just a passion somewhere in them that allows them to really want to be engaged in our program, that allows them to see the impact of what they can do, and really, we really look for that spark. So again, they don't need to be great presenters. When we hire them, they don't need to be experts in anything other than being a teen and sharing that experience with us as adults. You know, it's also a unique opportunity that they apply kind of on their own, and we really look for unique identities when we're hiring as a team for teams that really complement each other. So we hire about 12 teen educators at each program site every year, and those teens, you know, it's incredibly important to us that those teens come from a wide variety of backgrounds with different experiences, coming from different home lives, different geographic areas of the county, you know, different schools, different grade levels. All of those have a really unique, obviously give them a really unique perspective on how they see the world and the experiences that they've had. So when we put them all in a room together, they're very different from each other. And I think that is a really unique experience for the teens themselves. And coming into this, it's not, you know, it's not like a club where they've joined with their other friends. It's something that they typically don't know anyone else in the room, and that's a big hurdle. We actually, in interviewing a teen this year, we had one that came forward to say that they wanted to cancel their interview because they actually just weren't comfortable doing something that none of their other friends were doing. And you know, luckily we had a short email conversation and asked, you know, very much respected that and offered to maybe chat anyway, just so that we could kind of allow them to interview us as maybe something that they would like to participate in. And I think once they realized that it was a safe space and something that we were committed to making comfortable, they stayed engaged and had their interview, and it was a great experience. So again, kind of looking for those teams that we can fit into a very diverse group, even though they, you know, it might be an environment that they've never been in before. And then the last benefit that I want to talk about in terms of being able to provide compensation for our teens and being able to provide that payment really allows some teens that may not have the capacity to participate, if they weren't getting paid, allows them to participate. So some of that just might be, they wouldn't have parent or guardian support to participate unless they were bringing, they were bringing in some money while they were doing it. And also, overcoming some of those barriers to transportation. We provide bus passes. We provide rides when we can, and really look for ways to make sure that that by kind of giving back and compensating the teens for their time, that allows a really diverse group to participate. And then finally, again, they get this sort of professional experience. So we definitely treat them like adults, like young adults in our space. And I think, I think as folks that may do youth work, often we are looking for ways to make things teen-friendly or to make things fun enough for teens or engaging enough or silly enough. And we've really found that often really what they're looking for is just a genuine human to interact with them. And so I think our model has really been based on just finding ways to, to engage them that we would with our adult colleagues as well, that we all like a certain level of engagement, but more importantly, that we really look for respect in the room, and we really look for that sort of ability to feel professional and to feel valued in what we do. So I think all of that kind of goes into our workforce development and employment model. And I'm going to let Erica talk a little bit more now, I think, about the training model and what happens after they are hired on as part of our team.
Can I stop you for a second?
Absolutely.
Yes. We've got a question about transportation. How do you mentioned bus passes. How else do you transport?
Yeah.
I'll take that, I guess. I've been doing it more recently with that. So we try really hard to offer a couple different things. The first thing we do when they come to training is actually sign a liability form from their parent or guardian so that we have that kind of off the table. We are not liable. If things happen, they give us permission for staff, volunteers, interns, other teen educators to transport them. So that's kind of where our base is. And then we work creatively from there. So often this is Erica, and I'm the program manager and site coordinator. So I'm often the one accompanying teams to workshops. So if that's the case, we meet at a central location, typically our office space or somewhere in between where teens live. We'll shuttle each other there. And I'll get into a little bit to some of our youth-adult relationship collaboration guidelines, because I think we have created our own and have a little bit of flexibility too. We don't have any rules where we can't be one-on-one with teens, for example. I know that is sometimes a challenge. We try when we can to get the teens together as a group, but sometimes it's one of us taking one teen home at the end of the night. So we do that because we have liability forms already signed. We do that on our own. Other things that we do, though, we create a carpool system for the teen educators. We know that some of our teen educators, because they range in age from 14 to 18, some are already able to drive, have their own cars, have parents that are willing to drive. And so we give them a map upon their permission of where people live with addresses. We give them who's willing to provide rides and who might need rides, along with phone numbers and things like that, so that they themselves can be responsible for coordinating rides on their own. And actually sorry, I have a cold, so my apologies. But that tends to work quite well, actually. We see that happen more often than I think I've ended up giving rides in the past year that I've worked with the program. So that's been really, really powerful. In the Madison area, that's also unique. We are a Dade County site, but most of our location is central, and our teams are kind of spread out along there, so there are people that are along different routes to pick people up. And I will say, too, we recognize our own capacity to be able to support teams. So we do try and hire a group of teams that there are some that will not need our support. They have the home support, they have the ride, whatever that might be. And then we, hire teams that we know we can put in that extra effort. So there was a team last year, for example, that voice was very important. We really wanted to get them involved in things, and so we actually ended up cabbing them. So we, I don't know how many of you are familiar with By Youth for Youth grants here in the Madison-Dade County area through the United Way, but one of the things we applied for that is actually money specifically for transporting teens. And so we use that in emergency situations when a teen maybe lives too far to actually get them a cab from one location to the other. Again, showing them their voice is really important, that we want them to be involved, and kind of re-engaging teens in the program in that way. So we do a couple different things. And then the bus passes, just generally, if people need it, we have it. We set ground rules with them. We sit down ahead of time and do it that way as well. So hopefully that answers the question. But if you have others, we are happy to talk through those logistics a little bit more. And so I'm going to move on to the training model, and I think this is really what comes in when Amy says we treat them like adults and we don't try to make it silly and goofy and teen. We just treat it like a job training. There are things that they have to do to be ready to go for the program. So the first thing that actually starts today, as Amy said, is our Teen Educator training. We do this before the school year starts for 20 to 24 hours. This year we upped it 4 hours to 24 hours. And what we do, knowing that people work better with shorter days, is we do 6 different days over 2 different weekends for 4 hours in a day. So tonight we'll meet from 4 to 8 p.m. We'll meet again on Saturday from 9 to 1. That allows them that break, but that also allows us financially to only need to provide 1 meal. So some of that is logistics on our end, knowing that there are funding limitations. Others are on their end, knowing that 8 hours in a day is just long, and no one can pay attention that long to a training. We are always in development making that better. So this is my 2nd year running training. We're making a lot of changes from last year, which was a lot of changes from the year before. I'm sure you all have gone through the same thing with any of the curricula you use in prevention work and any of that. The biggest thing about training is really setting the space. So PATCH is a program where they are there for a common goal and not necessarily a common identity, which is pretty different for a lot of the teens who come in. Like Amy said, they're not with their friends. It's not a club where they go together because they all have this in common or something else in common. They're really all there to improve adolescent health care. They're there to share their stories, and they're there to bond over that experience of being a PATCH teen educator. And so that's kind of what we bring in. We talk about our PATCH program values and mission and vision. We really share with them our Teen Educator Creed that we've created that really kind of outlines some of the beliefs that teens have rights and responsibilities and are wonderful, powerful voices in this work. And we do a lot of activities to help them bond over their differences too, and to see the importance of their individual stories. We encourage a lot of discussion. We challenge the social norms a lot in what we're doing. I know many of you have done icebreaker activities, but we find them very powerful, and particularly when we pick ones that work well and are a little bit different. So one of the ones that we implemented last year is a walk and talk, where they get to just have an honest, open conversation about values. So we give them a statement, they talk about if they agree or disagree with it, where those different points may be, and then they just, in pairs, walk around the room, find somewhere to sit, really kind of engage in a way that's different and not mediated by us as adults. We do a really powerful activity at the end of our first night that's called Enter the Circle. It's also, crossing the line, the values walk, things like that I'm sure many of you have done. But we find it really great in our evening training, particularly because there's a mood that is set. It becomes a very intimate moment. As you all know, no one speaks during that, and it really is a way for them to reflect on where they're at, where their identity is within this whole group that shares things, doesn't have some of the identities that we would love to have represented and all of that. And then even those basic icebreakers, we're always searching for the uniqueness of individuals. We want them to connect, but that unique individuality is really what makes this program powerful.
And I just want to touch on one thing Erica said that I think is really important that we don't think a lot about, is that we've recognized and learned that the timing of the program really has a big impact on what we're able to do. So Erica mentioned there are certain things that we only do during the evening trainings or evening workshops, because there is a different mood in the evening. There's a, teens, and I think everybody are in a different space when it's dark outside versus when it's light outside. And there are certain things that we do in the morning. So really, I think taking that into consideration in terms of what your goals are, kind of timing it in not only a physical setting, but also just sort of a timing that works for the group as well.
Okay, I have another question.
Yes.
Do you have a website or a blog or somewhere you go to find some of these activities that you use for teens?
That's a really good question. Off the top of my head, there's nothing, but that also is something that I think we maybe need to work on better, is sharing some of those, highlighting some of those. So we're really trying to be more active on social media. And I don't know if we have all that, but all that can be found on our website. So we're www.wipatch.org. So we have a lot of our information, but not so much the activities that we use. We do a lot of Google searching. We also have a lot of in-house, like over the 6-7 years now that we've been doing it, that we just kind of have stacked on stacked stuff.
And I will say we also, we work a lot with interns, and interns are fabulous at helping us come up with creative ways to engage other folks. So a lot of times they were, you know, they did some things as freshmen in college with their residence halls that were really effective, and so they bring us those ideas. I think interns are responsible for a lot of it. And like Erica said, Erica just does phenomenal Googling, and you know, and I think eventually we've tried things out that don't work as well and kind of modified as we go. I wish we had something more concrete to give you, but
a lot of it is that modification piece, though. I think we've realized what we have a voice for patch that we like to try and work on. And therefore, we do a lot of modification on some of those standard things to change them to be very patch related. And so we know what you're doing is not necessarily patch, but it relates to patch and the prevention work that you're doing and all of that. I will say, as we prepare to replicate the patch program, we are putting a lot more of this in a training binder. I can't even think of what the right word would be. We're putting it down on paper. We're having a file for this, so I think if it's something that interests you and how we do this training, please reach out to us in the coming months as we prepare to kind of expand throughout the state and nationally. A lot of these things are going to be more formalized and more written in places that we're ready to share, I guess. So while I don't have a concrete answer at the moment, I would love to stay in contact and kind of talk about what you've seen that works too, because I think that's powerful too, to share tips and tricks that we've seen there. So hopefully this, we know today it can't really be as two-way of a conversation as we'd like, but we would love to do that continuing forward. I guess one of the other things we do to get our teen educators to talk about where they're at, to cultivate their own identity, but also realize people are coming from these different backgrounds, is we really like to allow them for moments of both strength and vulnerability. We find that really important. And I know in empowerment work, we always want them to feel empowered and ready to go, but we also need to leave room for that vulnerability in those moments where maybe they're not at their best and they can recognize that, and they just need to let people know that. And so in those moments, or at the beginning actually of every meeting, we do what's called roses, thorns, and buds. So it's kind of like a highs and lows thing. So it's, you know, a rose, what is going really well for you? What are you excited about in this moment? Did you get good news? Anything really exciting. A thorn is maybe things that aren't going so well. Did you have a rough day? Do you have things going on with friends or family? What's happening in your life that's maybe bringing you down a little bit? And then a bud is something you're looking forward to in the future. It can be tomorrow, it can be next week, it can be in months, but something that's going on. And we engage in that too as the adults, and I'll get to that youth-adult collaboration as kind of our last piece, but that becomes really powerful because it's sharing a piece of ourselves with the teens and the teens sharing a piece of themselves with us. We don't spend a lot of time on it, and often there are things that you will wish that you could unpack more with them, but it's also nice to know as a check of, do I need to check in with these teens, what's happening in their lives, and they really become a huge support system for each other and actually do it when we're not around at other events. So that becomes a really great way to get them even just thinking about and acknowledging that we want them to bring their best selves, but we realize their best selves isn't always going to be on their A game. It can be something where they're struggling with other things that are going on. And then through training, we also do skill building, which is always important. We really focus on storytelling. Again, that individuality, and we know that stories are a great way to elicit emotions and to really work towards change, particularly with healthcare providers who have seen teens. That's a great way to do that. We work on their presentation skills. Amy does a great workshop with them about communication strategy and what's the difference between interpersonal communication versus presenter style, and all of those kinds of things. So we really do leave them with concrete skills so that they can go into the world and be teen educators while they're in workshops, as well as when they're just kind of interacting with peers. The next part of training, and then I'm going to pass it off, sorry, I feel like this is taking a while, is enrichment. So Amy mentioned briefly that throughout the year we have enrichment meetings. And what those are is they are 2 hours every other week, 2 times a month basically. And we don't necessarily talk about their role as a teen educator in this, but we talk about topics that can provide them with tools and outlets for them to use that spark or that energy to think about the world in a different perspective. So we have a curriculum and there are topics to talk about. I mean, health topics are important because we're a sensitive health. So we talk about sexual health, and mental health and alcohol and drug abuse. But we also really talk about things like bystander intervention was one that we had somebody come in and do last year. We talked about financial literacy and how important that is for them and their health. We talked about social justice work, knowing that that's a huge part of our organization. So we really kind of expand these topics beyond sensitive health topics to other advocacy skills. We have somebody come in to talk about policy and how they, as teens, can be involved even though they can't necessarily vote. And so the whole purpose for this is to build them up as advocates, both, again, in their workshops as well as outside of that workshop space, so that this message can kind of go further than just those 90 minutes that we're with providers or the 60, 50 minutes that we're sitting with other teens. The teen educators do ultimately have control over the topics. We have a curriculum, like I said, there are some set topics that we have to talk about every year, but we try to make the focus different. We bring in different speakers. The second half of the year tends to be really teen educator driven. So last year we had one on disability in healthcare because the teen educators wanted to know more about how they could support their teens who had disabilities or had unique healthcare needs and things like that. Our biggest thing is that the topics are always relevant to what's happening now. Sometimes that changes if something big happens in the world. We bring in a speaker, we lead just a discussion and give them a safe space to be there and be in the moment. They're engaging and they're useful for them, and I think that's what we like. We're not trying to make it fun. You know, activities are great. We want it to be interactive, but it doesn't, again, it's not necessarily like, these are teens, let's do something we do different for teens. It's really just making it useful to their everyday lives. And so that's been really powerful when they can leave the room and have these conversations that we've had in Patch, outside of Patch. And then the other thing that we do with these enrichment meetings is we have requirements for our speakers who come in. So we, being part of the Wisconsin Alliance for Women's Health, do have standards. We do have our own values and beliefs and things that kind of influence the work that we do. And so we want all speakers to be passionate about what they're doing. We want them to provide interesting debates and interactive activities. We want them to realize where Patch is coming from so that our messages do align to some extent. So we do have our Teen Educator Creed that we share with all of our providers, and we say, you know, we want you don't have to address all of these things, but if you're addressing a topic, here's where Patch stands on this view, on this belief, so that you know whether you align or not, and we can decide together if you're a good fit. So that's ongoing conversations with our speakers who are coming in. And really our whole goal is to educate, engage, and empower. So we situate our workshops so that they're doing those three things, and we do the same thing in enrichment meetings. We spend some time educating, we spend a lot of time engaging, and then at the end we do this empowerment piece, however that may look. It may be, okay, so what's your next step, or some of those motivating pieces in between that. So it's kind of what we do for training. It's ongoing, it's changing, it's flexible, but it really allows the teens to take control and take what they learn in Patch out to the world around them, which I think is really powerful.
Absolutely. So we're going to move on and talk a little bit now about kind of this empowerment model, and there are three ways, I think, in which we allow our teens to become really empowered to engage in advocating for preventive health care. And I think the underlying message, I know we've said this a number of times, but we really do work to treat them like adults. And I say this again because I think it's very seldom that teens are given a space where they're fully respected. And so I think a lot of times when it comes to, you know, the things that are going on in their lives, it's looked at as drama, or it's looked at as something that's not going to matter in 5 years. And a lot of those sort of inherent biases that we have really belittle the teenage experience. So I think in all of the things that we do, we just make it a very high priority to recognize that that their reality is their reality, and that is what they're dealing with, and that is entirely valid. And so listening to what's important to them is very important to make sure that they are, one, not only recognizing in their own lives where they may need some prevention work, but also being able to feel empowered to recognize that they have the ability to be advocates for their peers. They have the ability to engage where they are and whatever, you know, whatever life they're living, that their voice matters and their story matters and their experiences matter. So as we mentioned, one of the ways in which we do that is through our workshops, which are entirely teen-led. And in that space, the teens become the experts in the room, and they lead the workshops start to finish. And we introduce them as sort of professionals and colleagues in this journey for health. And I think in doing so really empowers them to recognize that they have the ability to participate. Small thing, but really important, is they have patch branded T-shirts that say Teen Educator on them. Incredibly important if they're gonna stand up in front of a group of people. That branding gives them the confidence, truly gives them confidence to recognize, like, I can do this. I am a teen educator. I am empowered to do this. So it's I think a lot of times it's hard to find money for things like T-shirts. I think it's incredibly important to recognize that they are a part of something. Second, we do engage the teen educators in advocacy and let them know that there are outlets that they can engage in, really empower them to be again, a part of this conversation for preventive health. Some ways in which we do that is, Erica mentioned, we really talk in enrichment kind of about policy and that's happening here in Wisconsin that affects our teen educators. And we identify ways in which they can be involved in that process. We, as the Wisconsin Alliance for Women's Health, host a Women's Health Policy Summit every year, and so we often engage the teens on a panel. We allow them a space to share their story with a very wide audience, and kind of bring them to that event so that they can see that there is a large community throughout Wisconsin that is trying to make the world better for them, and that they can be a part of that conversation as well. And also that they're not alone in it, that there are a lot of other folks out there that can mentor them, that can be role models for them as they kind of find their own, the advocate within their own selves.
And also the advocacy looks a lot of different ways. Instead of we don't just focus on the political piece, but individual advocacy in the workplace and things like that are really highlighted at the Policy Summit. So I think it allows them to see advocacy in a different light that many of us see, but maybe don't necessarily call advocacy all the time. And that is really powerful for them to realize they have that change. And I think Amy's going to talk about how they do that in their schools. But
absolutely. So some of the tools that we work to share are, again, looking at ways in which they can engage in change in a way that maybe isn't considered traditional advocacy or policy change. So we work them through doing, we've had teens that have done things like starting GSAs in their schools, or starting Empower Hour was a club that was started at one of the high schools here in Madison by some of our teen educators that really spends an hour every month. They bring in speakers and kind of talk about some of these issues that teens want to feel empowered about or want to be engaged in and isn't being taught in their school. They have been invited to participate in revamping health curricula for some of the schools around the state, which has also been really exciting. And so, recognizing that there are ways that they can be engaged just within their schools and within their friend groups even that can provide them opportunities to raise their voice and to be engaged. And it's really beautiful to see. I think often what happens is as teen educators go through our program, they become sort of these natural advocates within their peer groups. So we hear stories, anecdotal stories all the time of teen educators who, people are stopping them in the hallway at school because they know that they have access to resources and knowledge that their peers might not have, and they kind of become this youth leader within their own friend groups with their newfound confidence and understanding of their own abilities. And then, we also do give them more traditional opportunities. We will bring them to the Capitol if there's something happening. I know when the Healthy Youth Act, for example, was being repealed, and our teens wanted to make sure that they had access to comprehensive, age-appropriate sex education. A number of them went to the Capitol and provided oral testimony, which was really cool to see. So they really start to recognize that their voice, once they're confident, having their voice be heard within workshops where we're supervising and they're trained and it's a safe space. It's really exciting to see how that translates into their everyday peer groups, and then also above and beyond when they're ready to be engaged in a more formal policy and advocacy conversations. Yeah, and I think I covered the last one early. So I'm going to pass it back to Erica to talk a little bit more about our youth-adult collaboration.
So this is our last kind of big thing in our Teen Educator training model, and from the work I've done with other youth organizations and my own experience being a teen a while ago now, but not that long ago, this is one of the things that I find to be most powerful, both for me as a supervisor and for the teens, is that we work to create a relationship. And we know there's a lot of, I'm trying to think of what the terminology is. We've kind of deemed ours a youth-adult collaboration. I think it says relationship on the slide, which is also that. But it becomes a team, essentially, is what we're trying to get at. We work really hard to build both professional and personal relationships with these teen educators, and that personal relationship is where the power comes in getting the teens engaged and motivated and ready. And I realize this can be really difficult depending on which organization you work for and what those standards are. So we're lucky being a small, scrappy nonprofit. We have a lot of flexibility, so know that that's where this is coming from. But hopefully you find some of it useful and interesting to kind of consider where you're at and if there's anywhere else that you can do more of this relationship building. And so we take this approach really because we are all people and we're all working towards the same goals. We've mentioned it several times. We treat them like human adults, not teens who are this homogenous group. They're all different. All of us adults are different. We want them to realize that we know that. And so we are confident in our programming, but we really give them space to change it because each year they come in as a different cohort with different concerns and needs and challenges. And the biggest thing is that we, as staff members, present ourselves as very real versions of ourselves. We talk about our flaws and our vulnerabilities. We talk about our own role models while we're also being role models for them. And we also recognize our missteps and our mistakes. We've all said things wrong, messed up. We recognize those, and we work with teens on how we can correct them. And so I think that becomes really powerful because that's the same thing we would expect of any colleague that we have in a workplace to be personable but also professional all at the same time. And we do make it clear in the workshop, because the teens are leading it, the teens are our colleagues. We make that clear to the providers. We pass it off to them. We kind of play that behind-the-scenes role because the teens are on our level. They know more than we do about being teens. They're the ones running it. And so we make it clear that we're solely there supporting them in the work that they do because we have more time and capacity than they do as students who are also in school and doing all these wonderful, amazing things. That being said, knowing that we create these personal and professional relationships, we've learned in the past, year and a half even, how important it is to establish the boundaries. In the past year, we have had a space for Patch now that is almost always staffed. And so some of that has been, that space has, because we've been doing this for several years and as we grow and expand, for example, adding space has made it so we have teen educators just kind of show up out of the blue some days, and that is good that they feel comfortable in that space, but also challenging sometimes to have work done, challenging because none of us are really trained in counseling or things like that, so if that's what they need, we can't offer that. So as we've had more space, as we've had more teens, as we've had staff dedicated more time to this program, it's become a bigger deal to be able to set those boundaries and communicate those boundaries. And so we really have been trying to become a part of a network with other people in the community, essentially, so we can refer things. And so, of course, as you can imagine, being where we're at, employer-employee relationships, mentor-mentee, coworker-coworker, friend-friend relationships get really blurred in this. And so some of this is challenging because we also aren't mandated reporters as Patch employees. We're not automatically mandated reporters. We're always looking out for their best interests, but we have that flexibility, which is also nice. But before I go further, I just wanted to ask, I know you all can only answer the comment question, but how many of you are mandated reporters or are but have some exceptions or aren't mandated reporters? We know you're coming from a variety of different backgrounds. And if you want to just type that in the chat box, we just want to kind of get a realm of where people are at.
No. One yes and one no.
Yep. So we see I have a yes and a no. Feel free to respond. So we clearly have people from all ends of the spectrum. And I think that that's great to know and think of. So we, knowing that we're not mandated reporters certainly benefits us to some extent, but it also leaves us in awkward situations of where teens know that they can speak with us, but we have this professional judgment that indicates when we need to necessarily do more for the teens. And so that was really hard to decipher some throughout the year when we needed to pass the torch and when we really needed to respect that confidentiality needs. There have been teenagers in the past, teen educators, who have used Patch as counseling but have been unwilling to let us refer them to a trained provider, for example. They've been using Patch Space, as I mentioned, as an escape outside of Patch hours. And all those things, to some extent, we're there to talk and we're there to give them space, but we can't necessarily reach all those things. So what we've done, knowing all these challenges and my kind of rambling through that, is we really worked to create a Teen Educator Handbook. And so we will send this out after the fact. It will be included when you get the link to the PowerPoint or somewhere, however that magic works. You'll have a PDF copy of our draft right now. But what it is first, it really communicates expectations for them as teen educators as well as boundaries. It really was slow development to get this guide going because we had to figure out what it was that we wanted to maintain as kind of our Patch identity and what we needed to respect outside of that. So the two of us that are here aren't mandated reporters. We do now have a mandated reporter on staff, so that changes things too for our Milwaukee site and the things that she's going to have to deal with and how that works and how she communicates that. So we needed to respect both of those things in our development. We need to give a huge shout out to GSAFE, who kind of gave us this initial inspiration and who really was our sounding board as we went through this, and still is somebody that we work with closely because they have some similar limitations and challenges and benefits from their role as staff members there. And so in this Teen Educator Handbook that you'll get, it talks a little bit about who their support system is. It talks about what their roles are and things like that. And then it really talks about this relationship between youth and staff. And so we have things that we're not allowed to do, particular things, you know, purchase alcohol, lend vehicles, have relationships with them, like sexual or romantic relationships, provide medical, legal advice, things like that. Clearly off limits. We're not going to do that as staff members. But then there's some places where we had challenges, and some of that was in social media connections, for example, was one where we've decided we think that's important for them to see us in our real lives with our families or our pets on vacations, or just kind of what we advocate for day to day. We found that really important to be able to connect with them in that social setting. But we also know that isn't for everybody, so we've built things for that into our handbook. We also have built in, knowing that I think the last time we gave this presentation we were still really struggling with where our boundaries were as far as reporting, and we've kind of gotten to a point where we say if it's something that's threatening your life, no matter our mandated reporting status, we are going to contact somebody in your best interest. And so we work through this handbook with them at training. So that's actually our first task for tonight when we meet with our teen educators, is to go through the expectations and really go through what those boundaries and barriers might be for us and what we can offer them.
And I think, as Erica mentioned, it's really, you can kind of tell it's our first thing on training. It's really important to us that we set the stage right away. We never want there to be surprises. We never want to break trust with any of the teen educators. We certainly don't want it to be a surprise down the road if they disclose something and we decide we need to reach out of our own capacity to support them. So everything is very transparent, very open, which really speaks to the heart of our organization and what we, practicing what we preach, making sure that we're having these very open, honest conversations and letting them know, that we are here to really to support them in every way possible, and that in some cases that's going to mean getting somebody else involved in that conversation. So again, it's the first, it's a high priority. It's the first thing on our agenda tonight at their training.
I'm not going to go through it with you because you'll have a draft to look at, and I encourage you to reach out if you have questions about why we approach things in different ways. But really the handbook is meant for both our best interest as staff, knowing that it gets hard to support teens in all the things that are happening in their lives, and we genuinely care for them, which makes it even harder. So it's for our best interest, too, to set those boundaries up front so that they don't have surprises, so that we feel confident and comfortable telling them that that's outside of our capacity. And then, of course, for the teen educator's best interest. So it's one of those things that's been developed thinking about both our role and their role and how they intersect, which is really powerful and makes me as an employee feel better to have had that, knowing that we will have this conversation, because it's not a conversation we had last year at training. And I think having this up front will prevent some of those really challenging situations we were in this year, and Amy has been in the past several years as she's ran the program. And so I'm really excited to implement this. This is our first time really this year implementing it. But that was our biggest challenge, I think, too, in this relationship piece, was finding how to set boundaries appropriately and respectfully while still being friends and colleagues and coworkers and all of those wonderful relationships that make it a powerful program. That's really all we have, unless you want to add anything else, Amy.
I'd love to invite questions right now. So if you do have questions, please feel free to start typing them in, and Kelly will let us know. And while we wait for those, I also just want to talk about a new initiative that we are starting outside of the PATCH program, but that might be really relevant to all of you, no matter sort of what community you're in. So we are currently launching a program called the Wisconsin Youth Advocates for Health program. And this is a statewide program where we are really capitalizing on all of these things we've learned about working with young people and empowering and engaging them. And the goal of this new program really is to get a statewide group of teens together and really empower them to impact decisions that are being made at the statewide level. So this group will come together, be trained as advocates, so they won't be PATCH teen educators. There will be a very different kind of experience, but with the same underlying empowerment model. So recognizing that their voice matters and that we want to create a space for them to speak up and engage in some of the state level conversations about adolescent health, about preventive care that we're having as professionals in the field, and make sure that their voices are also at the table and that they are available for kind of consulting work, really, so that we have teens that we can reach out to when we have questions about the programming that we're creating or doing, and we kind of have the sounding board of youth. They will also then be going back into their own communities throughout the year and doing individual projects, many of them prevention projects within their own communities on something that they're passionate about, that they want to see changed. And we're always going to be looking for adults in those communities to connect, to really be mentors as they kind of go back and try to make change in their own communities. So I'm going to try to ramble off the counties that we're working with right now. I may forget one, so please feel free to follow up. But we are currently working with teens in Ashland, Bayfield, Sawyer, Oneida, Wishara, Brown County, Milwaukee County, Racine, and Rock. And I think I got them all. I may have missed one in there. Eau Claire. I missed Eau Claire. But if you're in any of those counties, and we are, the application is closed for this year, but we're going to be looking for again, for adults to connect with the teens that we do hire in those counties. And then in future years, really, we'll be looking for additional teens to become part of that program. And again, it's a new program and will be growing, and I would love support from throughout the state and kind of getting this off the ground. So if that's something that interests you, if the youth empowerment model sounds intriguing to you, please let me know, follow up with me. I think our last slide here is going to have our contact information. So please, again, we'll follow up, I think, via email anyway with a link to our website, but please feel free to get in touch.
Okay, we do have a question. Are the teens required to be in high school?
Yeah, that's a great question. So for the PATCH program, yes, they are required to be high school students. They can be freshmen through senior year. We also find that often when they graduate, they stay around as interns or as mentors or on community advisory teams in some way with the program once they've moved on and out of high school. But for the program Amy was just talking about, no.
Yeah, for the Wisconsin Youth Advocates, the statewide program, we actually recognize very often, specifically in preventive health and preventive care, high school's too late. So we are actually looking at, we have some 7th and 8th graders all the way up to some college undergrads that are interested in joining the team. And that'll be a really unique and dynamic, but recognizing that all of their voices are really important and they have stories to share, and so that group will be a wider range.
And we've also seen the need for PATCH-like things in college-level things. So while our teams themselves are high school students, there's also PATCH is constantly growing and changing and developing. So hopefully you will kind of keep in touch, seeing what's happening on our Facebook or Instagram, Twitter, website, newsletter, the variety of things that we do. But know that that's also been on our radar, that there is a need at college level to empower college-aged people to take control of their own healthcare too, and to give them those resources that they need. So that's something that's been on our radar too, and hopefully come someday as Patch expands.
Okay, another question. What does recruitment look like for Patch? How do you find teens? How do you connect with them?
Great question.
That is a great question, and we actually had a really successful year this year. So we're lucky that we have a lot of community connections and community support people, much like WCASA. We interact with lots of people on lots of different things. And so being the site coordinator, I really dedicated, I would say, several weeks of my job to reaching out individually and as a whole to the organizations we work with. We're on listservs that do youth work. So we put out a job description. We talk one-on-one. We send reminder emails to all of the adults that are working with teens, so health teachers, school principals, administrators, school nurses, actually a lot of our teens come via recommendation from their healthcare provider of some kind. So that's really cool to see that they are actually in their provider's office getting this information from them. So we do all that through adults. And then our teen educators are really powerful recruiters too, among their friends, among random people in clubs. A lot of the older teen educators become an inspiration for the freshmen or sophomores at their schools when they go talk to their classrooms, these initiatives. And so they do that. Word of mouth with teen educators a lot is another huge way. And they do have to fill out an application. And so one of the other things we really dedicated to this year was we can see in our application portal if people have started an application and not finished. And so in the past, we've had lots of incomplete applications where people started it, lost track of it, didn't necessarily go back in. And so we really worked on sending them emails, encouraging them to apply, wanting them to know that their voice matters, and we want to meet them and we want to get to know them. And so I think, again, that individual reaching out via phone to adults, reaching out via email to teens who had expressed interest but maybe hadn't completed an application yet. My apologies. All of that has been really powerful.
And this year we also have, as Erica mentioned, have the ability to kind of see what's going on in the application process. And therefore we were also able to kind of look through and look for needs that we had. So we recognized, we were able to see, oh, we really don't have a lot of male identifying teens applying. Let's do some outreach. Or, you know, we don't have a lot of Spanish speakers, or whatever that unique group might be, race or identity, gender. Be able to kind of reach out to our partners that maybe work with some of those populations and encourage them a second time, you know, kind of encourage them with more focus that we're really looking for teens from a certain demographic maybe to apply to our applicant pool. So we kind of did a second take and reached out as well.
I also was going to say, when we were working individually with health teachers, people in schools, people that are doing other youth advocacy work individually, we ask them to share it widely, but then we also really ask them to recommend individual teens, because that is powerful in a teen's world for someone to come up to them and say, oh, this person said I would be really good at this, so I applied. We hear that really often, actually, that it's based on that single individual person who has recommended it. And so that's one of the things we really ask our partners. I will also say this year in Milwaukee, one of our wonderful community partners, and I actually don't even know who it was at a job fair and shared the Patch information for 8th graders, and we had a huge number of freshmen apply because they'd been at this job fair and they'd seen Patch because it's a job listed and were really interested in what I was doing because it had that teen voice component. And so I think that there are ways that we haven't even tapped into yet that are going to be really powerful recruitment tools.
Okay, another sort of follow-up question to that. What type of application portal do you catch that info in?
So we use a form called WUFOO. It's not the best. We're still working out some of the links. It's WUFOO. Google Forms also works, and we will likely maybe move things over to that because we've had some email errors and technology things. But the great thing is that we can see if people have started an application there, and it does allow us to export and to print and do all those wonderful fun things. It's basically just a form as opposed to an application. And for those of you, if you're interested, I don't know if that is part of a question, but our application, again, we're not looking for expertise and grades. We are looking what their experiences are. We want to know if they can tell a story and if they have a story that they're willing to share. So we ask them a lot about their own beliefs and opinions and experiences. It's essay questions for the most part, that they can decide how short or how long to do it. That does not, how well they write doesn't play into it. It's really, are they passionate? Do they have these experiences that they want to share? And we also want to know what their support system's like. So we have them give references of people that really inspire them and things like that. And so it's talking about diversity and if they've had that experience, but it really just allowing them to tell their story, I think, is what that is.
Great. I just sent the link to
Woo-hoo.
Thank you. Anything else? Any other questions that folks have?
So here's a question that, this is Kelly, here's a question that we get a lot around maybe some anxiety around doing really youth-led, youth-empowered work. And we do, every other year we do a teen summit, and so this comes up in the planning process. And can you just, maybe it's not maybe a super well-defined question, but talk a little bit about why that framework is so important and how you maybe overcome some of those fears of like letting go of control and really engaging youth to be leaders in the work that they're doing.
Yeah, I think that's hard. That letting go of control is something that we don't do entirely. I will be first one to say that we don't necessarily do the youth-adult partnership lens because we found in the way our program works, we can't necessarily let go of all control because we are CME, C&E accredited. There's certain things we have to do. But knowing that we have set this foundation that we're really comfortable in, and I think that's what's nice to know is we have this foundation and then the variation and the language and the teen stories that come out of it are the things that we really try to empower them to do. And we do let go of control sometimes. We let them kind of speak from their heart and give that information. But I think having a solid foundation has made us less anxious about turning them loose in a room without our immediate guidance, I guess.
Yeah, and I think another lens that maybe helps is, like Erica said, I think there's a lot of youth-adult partnership models out there that really turn the reins over to the teens, and the teens feel as though they're leading. And I think in terms of our employment model, we really look at this more like, Erica's their boss. So the teens have a boss, and they're part of a team, and they have responsibilities. And we certainly trust them in their role, but I think it's a really realistic way for them to enter the world, to know that they have a voice and they're participating in something. But they're not, it's not a free-for-all. They're not running the show. They also have to learn, sort of that mutual respect, and they need to learn that Erica has goals and things that she needs to do, and they're there to make it happen, and just certainly share their opinions. And again, we spend a lot of time making sure that their voice is recognized and is respected. But we also make a space for them in a very realistic role where they have a job and they're part of a team, and they're not kind of running away with anything. I will also say I think there's a lot of anxiety, and I just want to kind of confront it up front, is that we spend a lot of time working very diligently to make sure that we're communicating with the young person. So after our training, on the last day of training, we have a celebration, and the teens are invited to bring 1 to 2 support people to the celebration. And at that time, that's when we meet a lot of their parents and guardians and support people. And after that, I think we spend time at that celebration introducing ourselves to those people, but also respectfully letting those people know that this is an opportunity for their teen to really take responsibility, and that we expect to be communicating with that young person. We expect to to really not have parental involvement, and that we encourage them to continue to ask their teens about what's going on and the program and what they're doing, but that we won't necessarily be providing any updates or anything like that to the parents throughout the year. And that's a little scary, but I think in meeting that head on and recognizing this as a really kind of a youth transition model, transition into adulthood, really powerful. And it doesn't, I will also say it doesn't stop other things from happening. So, for example, I was just on the phone yesterday on an interview with a youth for the Wisconsin Youth Advocates team, and got cut off from a Skype interview, and called back the phone number that she had on her application and tried to give it a call, and her father answered and didn't know that she had been in the middle of interview and was not happy and was asking a lot of questions about what this program was. And and again, I think just being confident, knowing that my response was, I really encourage you to ask your child about this and have that conversation. But I really am interested in interviewing the applicant, and so thank you very much for your time. And really kind of hope that and then got back in touch with the young person and let them know that I had had that conversation and encouraged them to start a conversation with their parent about what they were interviewing for and share the resources. But again, it's about really encouraging that team to be the one communicating with their parents and be advocating for their own sort of participation in different things, instead of being kind of cutting the teen out of that conversation and being the ones to communicate directly with the parents. So it takes confidence and also transparency. So we're very transparent about who we are and what we're doing, and we spend a lot of time putting ourselves out there on our website and on social media, our Facebook page and things like that. So we can kind of always point to our identity and who we are. So parents certainly can see what their teens are participating in, but we're not directly communicating with them.
Another question.
Okay. Yeah.
You two are here, but how many employees work directly with this program, and do you use community volunteers as well?
That's a great question. So we've grown. This is a fun one for me to answer. So for the first 4 years of really almost 5 years of this program, it was just myself as a half-time staff person running the program. And in the last year, we've really been able to expand. We now have Erica as a full-time staff person, and we also have a development staff person, so someone who's really dedicated to, again, this replication, kind of behind the scenes, getting the program model ready for other communities to be adapted elsewhere. So there's the three of us, and then we also have a staff person in Milwaukee who's getting ready next weekend to launch the program there in Milwaukee. So there's really the four of us that are working on, that are paid to work on this project. But as I mentioned before, we also rely very heavily on interns and volunteers. So we have a great relationship with the University of Wisconsin here. So we connect with a lot of for example, there's a great internship program through the Gender and Women's Studies program that we connect with. We also are an approved site for Masters of Public Health students that are working on their field work, social work students, Masters of Social Work students that are working through that program. And so we have these, incredibly brilliant, helpful, efficient and effective young people that are getting credit to also help with our work, which I think is also one of the reasons why we're able to do so much. And as Erica said, we also have teens that graduate high school and want to stay involved. In fact, we have a young woman right now who is doing field work with us, who 6 years ago was a teen educator her senior year in high school, and has been volunteering with our organization ever since, and is now back as a master's student doing her field work with us. So we also just really we definitely capitalize on the support that we have and the young people that help us drive the program.
I also want to mention that we have a lot of people doing behind-the-scenes stuff, but the people who are actively engaging with the youth is actually far smaller, because we realize that teens do need a core group of people that they can count on. So that becomes our site coordinator, which is myself, and then our Milwaukee supervisor, Patrice, and then we work with our supervisors. So Amy is my supervisor, and I'm Patrice's. So we become kind of the two big adult patch staff members. There's two of us that are really kind of their main contacts, that are there frequently, if not always, for all of their meetings and workshops and things like that. And then we really want to have them have one intern. So they have one intern that is really with them for the whole year. That intern plays a really huge role in supporting the site coordinator with little things like getting donations and things like that, but they also are this wonderful liaison, because they're not quite a teen, but they're not quite this adult staff member. So they really interact with the teen educators in a different way. They become this confidant and trusted resource for the teens. They all have a Facebook chat together where I'm not privy to anything that's in there. about our intern is, and our intern is really great. We form relationships with our interns as well as, our teen educators. And so it's really this communication between us and the intern, too, if there's things we should be aware of. And that's also part of our guidelines is how do we set boundaries, too, so the interns aren't getting all of these really rough things. But we do try, while we have a lot, we have lots of speakers. We have a community advisory team that also is a huge support network of people from the community in healthcare, in youth organizing, and in schools, as well as kind of an array of other things. So there's a lot of community volunteers that are helping us out, but that direct one-on-one contact and the consistent contact with the teen educators is a pretty limited group of people, which I think is important to realize too.
Absolutely.
Yeah. Others? Okay. Thank you so much for letting us spend time with you. We hope you keep in touch, and we would love to hear about the work that you're doing too if you keep in touch with us. It was wonderful to get to talk to you. And
absolutely, please keep in touch. Again, our info is on the screen, and please don't hesitate to reach out. It was a pleasure being with you all today.
Yeah, thank you both so much for being here today. I think there were a few people who said that they are planning on getting in touch with you. So
excellent. We look forward
to some emails coming your way probably.
Great.
Thanks again, everyone, for attending another one of our webinars during our Prevention Summer Series. Just a reminder, again, we are going to send out information today, I believe, for the webinar that was rescheduled for this coming Tuesday. So look out for that information. And again, if you have any other feedback or other questions about this, please feel free to contact me at jessec@wcasa.org. Other than that, I think we're good to go. So again, thank you all so much, and thanks to Amy and Erica. Great presentation.